depression and anxiety are on the rise worldwide, affecting millions of people across all ages, backgrounds, and cultures. The mental health crisis has become one of the most pressing issues of our time, but why is it happening now? In this video, we'll explore the factors contributing to the rise in depression and anxiety, the impact on individuals and society, and what we can do to address this growing problem. Chapter 1. Understanding depression and anxiety. Before diving into why these conditions are on the rise, let's first understand what they are. Depression. Depression is more than just feeling sad. It's a serious mental health condition characterized by persistent feelings of sadness, hopelessness, and a lack of interest or pleasure in activities. It affects how you think, feel, and handle daily activities, sometimes leading to severe outcomes if not treated. Anxiety. Anxiety is characterized by excessive worry, nervousness, or fear that can interfere with daily life. It's normal to feel anxious sometimes, but anxiety disorders are intense, prolonged, and often occur without a clear cause, affecting a person's ability to function. These conditions can occur together, and they're becoming increasingly common in today's world. Chapter 2. Why are depression and anxiety on the rise? There are multiple factors contributing to the increase in depression and anxiety. Social media and technology. While technology has connected us like never before, it's also been linked to increased rates of anxiety and depression. Social media can create unrealistic expectations, encourage comparison, and contribute to feelings of inadequacy and loneliness. Economic uncertainty. Economic stresses such as job insecurity, student debt, and the rising cost of living can lead to chronic stress, anxiety, and depression. Many people feel overwhelmed by financial pressures, contributing to mental health struggles. Global events. Events like the COVID-19 pandemic, wars, natural disasters, and climate change can have a significant psychological impact. The pandemic, in particular, led to widespread isolation, job loss, and uncertainty, exacerbating mental health issues. Work and academic pressure. The modern work and academic environments often demand high performance, leading to burnout, stress, and anxiety. The pressure to succeed can feel relentless, especially for younger generations facing competitive job markets and academic pressures. Lack of mental health awareness and support. Although awareness of mental health issues is growing, there is still a significant stigma attached to seeking help. Many people avoid talking about their struggles or delay getting the support they need, which can worsen their conditions. Lifestyle factors. Poor sleep, unhealthy diets, lack of exercise, and excessive screen time can all contribute to declining mental health. Our modern lifestyle often neglects the basic self-care practices that are essential for mental well-being. Chapter 3. The impact on individuals and society. The rise in depression and anxiety doesn't just affect individuals. It has a ripple effect across society. Personal impact. People struggling with these conditions often experience difficulties in their relationships, work, and daily functioning. They may feel disconnected, unable to enjoy life, and struggle with feelings of worthlessness. Economic impact. Depression and anxiety can lead to reduced productivity, increased absenteeism, and higher healthcare costs. In fact, mental health issues are among the leading causes of disability worldwide, impacting economies and workplaces significantly. Social impact. The mental health crisis affects families, communities, and social structures. Increased rates of depression and anxiety can lead to higher levels of social isolation, substance abuse, and, in severe cases, suicide, which is a growing public health concern. Chapter 4. Addressing the mental health crisis. To tackle the rise in depression and anxiety, a multifaceted approach is needed. Mental health education and awareness. Increasing awareness and understanding of mental health can help reduce stigma and encourage people to seek help. Educational programs in schools, workplaces, and communities can play a crucial role. Accessible mental health services. Access to affordable and effective mental health care is essential. This includes therapy, counseling, and medication when necessary. Governments and healthcare providers need to prioritize mental health funding and resources. Work-life balance. Encouraging a healthier work-life balance, flexible working conditions, and mental health days can help reduce workplace stress. Employers can play a critical role in supporting their employees' mental well-being. Promoting healthy lifestyles. Encouraging physical activity, a balanced diet, good sleep hygiene, and mindful practices like meditation can improve mental health. Simple lifestyle changes can have a big impact on reducing symptoms of depression and anxiety. Community support. Building strong social connections and support networks can help individuals feel less alone. Community programs, peer support groups, and online platforms can provide much-needed social support. Early intervention. Early intervention can prevent mental health issues from worsening. Teaching young people about emotional regulation, resilience, and coping strategies can equip them with the tools they need to manage stress and mental health challenges. Conclusion. A call to action. The rise in depression and anxiety is a complex issue that requires a collective effort from individuals, communities, governments, and healthcare systems. By understanding the factors contributing to the mental health crisis, supporting those who are struggling, and advocating for better mental health resources, we can begin to turn the tide. Remember, seeking help is not a sign of weakness. It's a step toward healing. Call to action. If you found this video informative, please like, share, and subscribe to our channel for more content on mental health and well-being. Let's continue the conversation in the comments. What do you think can be done to address the mental health crisis?